I'm Dr. Saraf, practicing neurophysician at Lady Ratan Tata Research Center, Kupraise. Now I'm supposed to talk with you regarding the epilepsy. Epilepsy is known around 3000 years backward a world, and this causes lot of burn to the society financially and morally. Now, what are the types of the epilepsy? The epilepsy is, majority what we are seeing is a generalized tonic-clonic seizures where the patient falls down to the ground with aura or without aura. Aura means he gets some premonition that he is likely to get a seizure. That is one thing. And then he sits down. Second type of generalized tonic-clonic, second type of epilepsy is absence seizure. The patient starts staring at the surroundings and lost the contact with the surrounding environment for 5 to 10 seconds or 15 seconds, and then he returns back to the surroundings. Third type of epilepsy is a complex partial and simple partial seizures, where the patients most of the time get some premonition aura in the form of a bad smell, or he runs away from the side, or some epigastric discomfort, and then he falls down to the ground with the generalized tonic-clonic seizures. Most of the time they are idiopathic in origin, but epilepsy can be because of tumor in the brain, infective pathology, and so on. Even chronic alcoholic people, we get alcoholic withdrawals seizures. Post-operatively, after removal of the seizures, after removal of the tumor, we do get seizures, and prophylactically they should be also treated. Now, what are the treatment options are available? There are so many good drugs are available right from 1950s onwards, especially phenobarbital, diphenyl hydroxide sodium, carbamazepines, oxcarbazepine. Some new drugs have come which are better because they don't affect the mental faculty, like levetiracetam, lacosamide, and lamotrigine. It depends upon which type of drug is to be given, depends on treating neurophysicians. Most of the time the childhood epilepsy, they get cured over a period of time, and around 80 to 90% of the patients can be controlled with the medicines, proper doses and appropriate medicine. In the past, we used to feel that this drug, this epilepsy is because of some bad soul comes to the body and that causes. It is not so. Now, how to diagnose this? The most important is epilepsy, and the history from, most important is history taking from the patients and an eyewitness who has observed the seizures. Now, this is more than, most of the time it is more than enough, but to know more about that, we ask some blood test, a EEG, and at times CT scan of the brain or MRI of the brain. Now, EEG is like a ECG. We pick up the electrical activity from the brain, and it guides us that which part of the brain is giving the abnormal activity or the origin of the seizures. Now, next thing, why we are doing the MRI or CT scan? We want to know the structural lesion in the brain, whether any tumor is there. Most common tumors which we see in our practice is tuberculoma or neurocysticercosis, and they are curable by the appropriate medicine. There are some which are caused in a late onset epilepsy, where we have to treat the patients with a surgical intervention. At times, intractable epilepsy, will need the surgical resection of the affected part of the brain, and the patients can be controlled after that with the medicine. If your near and dear one getting seizures, don't crowd around him, don't get panicky, make the close loose. The old theory of putting the fingers or a handkerchief in the mouth is to be avoided. Till he become fully conscious, don't give anything to eat or drink, and no sharp objects is to be kept nearby. In the past, there was a dictum that give the onion smell to the patients, or a bad shoes, old shoes, gives the smell to the patient will come out. It is old theories and as not having any scientific value or basis. Contact the doctor immediately if it is a first seizure and let him examine. And if it is a routine seizures which is coming every now and then, don't get panicky and meet the doctors informing him this. Now the treatment has to be continued for regularly, that is a must. Once he is diagnosed, that whatever the appropriate dosage is advised by the doctors. Now do's and don'ts are with the patients are that they does not take the job which are working on the height or nearby the heavy machineries. No swimming is allowed. Driving is a questionable thing, but at least 1.5 years there should not be any driving on the highway especially. Take the medicines regularly, sleep 8 hours regularly, no stressful things, and don't skip the medicine. That's the crux of the epilepsy treatment. Don't feel that you are having some bad soul in your in your body, and that is causing the problem. It's just an electrical disturbance of the brain, and which can be controlled and cured. Remember, there is a misconception in the society that marriage cures the epilepsy. It is not true, first. Second, people feel that it is going to be in the children's, in their offsprings, which is not true also. The reason is very simple, it is not a hereditary disease. Most of the time it is not a hereditary disease. So second thing, this is more important. And they can do all the activities except working on the heights and nearby the heavy machinery or fire. And fourth thing, when there was no much treatment is available, the people achieved in their career, right from Napoleon Bonaparte to the Bran Lara. They are all suffering with this disease, and they have excelled in their career.